The timing of the launch of this global report by UNAIDS comes at a telling time, at a time where we see funding cuts towards HIV/AIDS programs. To speak to us and unpack what this impact will mean for the global agenda on HIV and AIDS, I have with me joining us Ms Winnie Byanyima, the Executive Director for UNAIDS. What is the impact of this if we bring it down to tangible impacts that will see communities affected, communities that were relying on TB and HIV programs that are close to their proximity in terms of residents?
You ask a good question. The impact is substantial, it's big. This is the biggest disruption since the global AIDS response started. We saw clinics shut, we saw many health workers laid off. We also saw research affected. This country, South Africa, where we are, is a leader in global research on HIV/AIDS, but it does it with significant contributions from other countries. That money was taken away, and that meant vaccine trials stopped immediately. So we see impacts everywhere. We're seeing prevention more hit than treatment. Many countries are putting their effort mainly on keeping people alive on treatment, but prevention is losing ground. 80% of the money for prevention was coming from outside. So governments where they were putting their money were mainly in testing and treatment. Now with the money pulled away from suddenly, prevention has been hit the hardest, and we are seeing new infections rising. There's a new suite of tools that could be transformational. Lenacapavir is one of them. It's by Gilead, and it's a long-acting injection twice a year, gives almost complete protection, 99 point something protection from infection. This is what a young girl here in Africa needs. The most vulnerable person is a young girl. To have something that protects them, that doesn't depend on the man or the boy she is having sex with. An injection, and she's safe for 6 months. It could even move on to being 1 injection per year. That's the closest to a vaccine, even though it's not a vaccine. So this, to be transformational, must be affordable and accessible. Sadly, the company Gilead is playing the old game of maximizing in the rich countries' profits while it is holding on to its technology and denying it to the developing countries to produce for themselves and make cheaply. Because you see, in America, it was approved only last week by the FDA. In America, it is at $28,000 per person per year. Researchers, whom we know, have told us it could cost as low as $25 per person per year if it is rolled out to up to 5 million people. This is possible.
Thank you for making time. That was Ms Winnie Byanyima, the Executive Director for UNAIDS. The report will present an opportunity for global efforts to move towards a trajectory of a renewed commitment. Zandile, Myeza, SABC News, Johannesburg.